Hi, my name is Phyllis Caves, and my presentation is on data sets and information management. What is a healthcare data set? Data sets in healthcare can include medical data, measurements, financial, statistical, demographic, or insurance. An example related to the hospital on the birth center would be birth certificates. After a patient gives birth, they are given a packet to file for their birth certificates and social security card for the new baby. Inside of this packet also includes questions asking the parents what their highest level of education is, if they receive government assistance, if they are currently employed or employed during the pregnancy, and their race. This information is then collected and used for Strong Memorial Hospital to apply for grants for the care of these patients and to improve the care of the current patients. The hospital takes this information and uses it to better understand what the patient population is that is delivering on the birth center. For example, if a lot of the patients were checking that they need government assistance and that they have lower levels of education, this would be an opportunity for the hospital to figure out better resources for these patients. An example would be maybe having a social worker more available or a care coordinator to better assist these patients with finding resources to care for their new baby and themselves while they're out of work, or to find jobs to care for themselves. This information is optional to fill out, but we strongly encourage all patients to complete the packet to its entirety, just so that the hospital has it. Other examples include minimum data set for long-term care, also MDS. So this is published by the Department of Health and Human Services. It is a standardized screening tool and assessment tool for residents in Medicare, Medicaid, long-term care facilities. It is completed at the time of admission or at reassessment periods. It is used to help the healthcare system because it aids in the development of care plans and placement. This information is helpful because it allows people to better see what patients that are on Medicare, Medicaid, what type of care they need in the long-term facility, and when they are applying for it, so their ages, their comorbidities, if it's a permanent or temporary placement. Another one is the Uniform Hospital Discharge Data Set, or the UHDDS. It is an initiative by the Department of Health, Education, and Welfare for hospital use on patients also with Medicare and Medicaid. It's used to help hospitals with principles, previous diagnoses, and procedures. So this information, once again, is only collected on Medicare and Medicaid patients, but it gives information on what this patient population, what their diagnoses typically are, if they're in any procedures that they're having, and this allows to see if there's any trends or common things happening among this group. There's also websites for data sources. So the first one is healthdata.gov. So this website is dedicated to making high-value health data accessible to more people. So some examples on here are just under the recently modified data sets, there's food inspections, healthcare provider, credential data, lead testing. So So healthcare workers can go onto this website and find information not only related to the hospital, but other information as well. There's also the World Health Organization, or also known as WHO. This website is information on global health priorities, health, and disease statistics. So this website not only gives information on the US, but also other areas in the world. Some of the examples, right when you click onto the website, are approximately 60% of children with suspected pneumonia are taken to an appropriate healthcare provider. So if you were somebody working in pediatrics, you could go on this website to better understand care all over the world versus just here in the United States. There's also the Human Mortality Database, and this database covers population data for roughly 40 countries. It was created to provide detailed mortality and population data to researchers, students, or anyone interested in the history of human longevity. So it covers areas from Australia all the way to like the USA. And if you were doing, so for example, if you clicked on the USA, you could find information on births, deaths, population size, exposure to risk, and this information is from roughly 1933 to 2017. So this is very beneficial to healthcare workers because you can see how many births are happening in the US and how many deaths are happening, and populations and their exposures, and use that information to better understand the population that we have at hand. Information management. So this is the collection or management of information from one or more sources. It's also the distribution of information to one or more audiences. So an example of this is electronic records. So electronic records, or what we would use in the hospital, electronic medical records, which any healthcare professional is using to put their data for their patient. So any assessment you put through the electronic medical record. The hospital then can use this information to better understand the population that is at that current hospital. So for example, at Strong Memorial Hospital, they can look at the charts of the patients, for example, the ICU, and if they were wondering about sepsis and how many patients had sepsis, they could track patients in that ICU and see how many had sepsis and go through their charts and look at their vital signs and their lab work and use this data to better understand if there was any warning signs to hopefully prevent sepsis in the future, which is something that they have done. So patients now, when things start to happen like elevated temps or increased white blood cells, a sepsis advisory will trigger. So this was created to help prevent a patient from reaching sepsis through data collection. They found that when a person starts to get a higher temp or starts to have increased white blood cells, sepsis could be coming. So this warning pops up now to allow healthcare workers to hopefully catch it before it gets too bad. So related to patient care, so data sets and information management are all used to continue advancements in patient care. But to protect the patients that we're getting all this information from, there's things such as the Health Insurance Probability and Accountability Act, as we all know, HIPAA. This was published in 1996. It is a core set of healthcare IT data standards. This is used to regulate the use and disclosure of personal health information. So this prevents any patient information from being attached to the data that is being used. So for example, going back to the birth certificates on the birthing center, all of the data collection part, none of that is tied to the patient. So the patient can put all that information down, but it'll never be displayed that so-and-so that had their baby on September 30th is an African American with a bachelor's degree. That will not be, that data is not shared. The data is strictly just African American bachelor's degree, no name tied to it, and that's from HIPAA. That's protecting the patient so that they don't have to worry about their name being carried on with the information. There is also the Health Information Technology for Economic and Clinical Health Act, also known as the HITECH Act. This was adopted in 2009 and is aimed to improve healthcare quality, safety, and efficiency through the promotion of health. This includes the electronic health records and ensuring that it is a safe system. For example, if your patient is typically for OB patients, if they have been seen at RGH, Rochester Regional, and then they decide to come to Strong Hospital because maybe they're in preterm labor, we are able to get their records, but in a safe manner where there is no concern that these records are being breached, that they are in a safe computer space, but still helpful to the patient that we are able to get their records. If the records cannot be shared as easily, there's also waivers that patients can sign saying that they give permission for healthcare providers to get their information and share it with others. This allows for the patient to feel that they have some safety also. Another example is when they add images into the chart. Sometimes these images are of private areas that patients wouldn't typically want pictures of. For example, related to the birthing center, sometimes they take pictures of tears after vaginal deliveries, or related to medical units, sometimes they take pictures of wounds on patients' bottoms. So patients need to feel secure that these images can be placed in their chart and that they're private and secure in the electronic health record. That concludes my presentation on data sets and information management. Thank you.